All right, so this is task list item number 17, client dignity. So some questions that I typically ask myself when I'm working with individuals, I think it's a little bit harder. First, I want to say, like, working with adults with developmental disabilities versus children. I primarily have worked with children, but there's still like a lot of similar considerations to make. But so these are generally just some of the questions I like to ask myself as I'm working in a clinical environment, generally whether it's with adults or children. But so these are some of my considerations that I think you should always keep in mind when discussing client dignity. So first and foremost, as a field, we're held to the standard of teaching socially useful behaviors. And they have to, they have to be socially valid and they have to be useful for the client altogether. So like I always want to ask myself, like, am I teaching a useful skill? Like, is this skill, once I teach it to the client, going to better their lives in some capacity? Is it going to open some doors for them? That's a pretty important consideration. I also want to ask myself, is this socially and developmentally appropriate? So, if I'm teaching, maybe, functionally, I'm teaching a skill, like some kind of play skill, to an adult with developmental disabilities that they might enjoy, but maybe it's not like socially appropriate. So like maybe I'm teaching them to play with, toys or something that's like way below their actual chronological age. And so, while they're learning this new skill, like it might not be developmentally appropriate. And in other words, is it going to open those doors for them in the future? Is it going to increase their kind of their independent functioning abilities? And the answer to that's probably no. Again, it's probably not wrong that they want to play with those types of toys, but is that a skill that I should be targeting? Probably not. So I think also another important consideration is a client's preferences, obviously what's already in their repertoires. But like, am I giving them opportunities to pick? So whether they're an adult or child, like, am I giving them like seceding control to them every now and then? So like during session, like, do they kind of get to pick what they work for? Or like maybe I get to let them pick like what order we do a skill in, or like a program in. So maybe they really enjoy this skill that we've been working on. So, we'll work on that first because that's what they pick. Or maybe they want to save that for last, whatever. But maybe, we're in the middle of a program and they're like, oh, I really would rather, I would rather do this program somewhere else, like outside in the big room, or, just like a small little kind of, what would you call that? Like they're asking for something so small, and it just kind of like a small concession for me to make, to where, if it makes them happy and it gives them kind of some input in like what we're doing, then, maybe I will kind of shape our lesson plan and our like skill building around that, because I want to make sure that they're having a good time and that is not just work, work, work. So I think that's important regardless of age. But another thing is, like, are they enjoying these skills that I'm teaching them? So if I'm only teaching them like really hard math skills and this kid hates math, like, yes, of course they do need to learn how to do math, but maybe I can make it a little bit more approachable. Or like I said, maybe I can let them pick the order in which maybe we save that program, or we get it out of the way first because they really, really hate it. And so I choose my most potent reinforcer and give them something extra because they really, really hate that program. And then another consideration is always like, am I talking to them like age appropriately? So obviously when you're working with children, that's, you talk to them in one way, but maybe if you're working with adults with developmental disabilities, not all of them want to be talked to like their children. I think you just kind of have to play that one by ear and see what they're comfortable being called. Sometimes you gotta just call them Mr. and Mrs. Because that's what's appropriate and that's what's respectful. Fortunately, I work with a lot of children, so that doesn't really happen a lot. But even so, I have learned that some kids don't like to be called things like sweetie or dear, or just like little pet names like that. Like I've had kids that I've worked with that have actually, this is my name, please call me by my name. And so you have to respect that and make sure you keep those in mind when you're doing sessions with those kids. So I also like, I think my most important is that like golden rule that I want to follow. And it's like, am I treating people the way I want to be treated? So I think the most important thing with client dignity is that I always think of it as like, whether you're working with adults or children, like, is this how, if I were in their shoes, is this how I would want to be treated? Or like, if someone was taking care of my child, or if someone's taking care of like my mother or father, or someone that I love very dearly, and they were, you know, they were the therapist and they were in charge of, you know, this other person's life basically, or therapy. Is this how I want them, you know, are they treating them with respect? So am I doing that? Am I valuing this person's time? Am I, you know, truly trying to help someone else's child succeed? And like, am I doing everything I can for that other person that I would kind of expect out of someone to do for me? So I think that's probably do unto others is probably my favorite kind of quick fix for client dignity. That's it.